everyone. It's great to be here. Good afternoon. I am Manisha Gulati. I'm the Chief Operating Officer at Clarify Health Solutions. Clarify is a precision analytics company that brings together more than 200 million patient-level lives of data, so clinical claims, social and behavioral determinants of health, prescription, and connecting it at the patient and physician level. So our team built the cloud-based analytics platforms for JP Morgan and Goldman Sachs, and we brought that technology and applied it to healthcare to be able to say, how do you actually match patients to better care, to be able to look at patient care journeys through time, increase speed to clinical trials, and use baseball-style analytics on physician performance. So we care deeply about access to data and analytics, and our goal is to help enable all organizations to be able to unleash the power of that. Before Clarify, I was a partner at McKinsey & Company, so I've spent more than a decade working with healthcare organizations trying to think about how to use data and analytics in different ways. And that includes both healthcare companies trying to advance growth and develop new products and use data, but it also means tech companies that were moving into healthcare. So it is a privilege for me to be on this panel and to have these guests on the panel with us today, because we're covering exactly that topic. So what is the competitive landscape in healthcare? What are the difference between what incumbents are doing versus what new players are doing? What does that mean for how you think about where to partner versus where to compete? And then how do you think about internal versus external innovations? What do you do yourselves versus what would you partner with other companies for? So we are grateful to have these panelists. As individuals, they have distinguished careers in healthcare, but each of their organizations is actually coming at it from a different perspective. So a health system, tech company, a medical technology company. And so we'll start with introductions and then dive into the topics. As was mentioned earlier, please send up questions. I have this iPad and I can see your questions live. So we will pepper that throughout the conversation and then come to questions at the end as well. So our introductions are also supposed to include a fun fact, and I will break the ice by doing that as well. I think I have a disproportionate and very unnecessary portion of my brain dedicated to 80s and 90s song lyrics. And so not cool songs like that my kids would be psyched that I know, but actually stuff like, Ice Ice Baby and Bust a Move is always going through my head when I'm doing dishes and known to sometimes break out in prose. And we'll start with Sarah.
Great, and if it gets boring, you can sing for us.
Yes, I was warned, we talked about it beforehand, that I better not get a challenge on the, the prompt here.
I'm Sarah Krevans. I'm the CEO of Sutter Health. We're an integrated healthcare system here in Northern California. We take care of about 3 million patients. We take care of more of the poor than anyone else in our Northern California footprint. Here in San Francisco, some of our facilities that some of you may have been to, our CPMC new campus on Van Ness and Geary, our new hospital that replaced St. Luke's at the corner of Mission and Bernal, our Davies campus, as well as physician offices. So hopefully we have some people in this audience who've been patients of ours. Fun fact about me, I know many of you travel a lot for work, so if you've been on an airplane and you've watched that movie about the guide dogs that are being raised in San Rafael, very fun movie if you want something totally light. My family and I raised guide dogs when my children were in high school. And if any of you are thinking about it, have another child instead. It was a lot of work.
I'm Josh Newman, Chief Medical Officer at Salesforce. We do customer relationship management technology. We're based here in San Francisco, as many of you know. Customer relationship management means a lot of different things in a lot of different industries. We serve all those different industries, and I work particularly in healthcare. And for us, customers are patients and physicians and partners and all the constituents in the healthcare industry, which are many. And we'll get to more of what we do, I'm sure, over the course of the panel. And my fun fact is, before medical school and during medical school a little bit, I was a stagehand with Local 2, the union in Chicago. I set up rock concerts, and I was a rigger, and I set up the lights. And we worked on a Metallica show. It was a 4-day festival, and we weren't getting a lot of sleep, so I slept underneath the stage during the Metallica show.
Wow.
It came in handy during residency, too, that skill.
Yeah, I'm Bernd Montag. I'm CEO of Siemens Healthineers. I have a PhD in theoretical physics that was recommended to intimidate people. Yeah? Let's say I have a romantic career, yeah, because I basically after this PhD I joined Siemens in the medical part of the house, and since then spent my career there and had the real privilege, yeah, to bring this to an IPO. Yeah, we are now our own public company with our own brand, our own identity, and that was a wonderful process. Yeah, so it's so to say a startup, yeah, a big one, but it's a very, very good experience. I'm really honored by it. And maybe some word about Siemens Healthineers, what maybe not everybody knows but should know. Yeah, we are the biggest B2B company in healthcare when it comes to equipping healthcare providers with technology. There's no one bigger. Yeah? I mean, there's device companies like Medtronic and so on, but when it comes to capital goods, yeah, when it comes to high-tech infrastructure, changing how healthcare is delivered from imaging to interventional workplaces to lab diagnostics, we are the biggest company, and we are basically whatever is done to characterize a patient. Yeah, with this is the imaging, this is the lab test, and so on. We are the biggest also provider of data, yeah, or generator of data and of knowledge. Yeah. Fun fact, I'm German. And we don't apply the concept of fun. Yeah?
We're talking about innovation, so. That's great. So we'll start with something more high level, and I'd ask it to each of you, which is looking forward, what is your organization's ambition in healthcare? And particularly given how fast technology is changing and the interplay between technology and healthcare, how do you think about it for your organization?
You want to just go down the line?
Go down the
okay,
line, that's
great. So when I think about it, and I think about who we serve, Sutter Health is a microcosm of the American healthcare system. I can start my day in a tiny little critical access hospital. I can go to a big urban facility. I can visit physicians in solo practice, or I can be inside a large preeminent multi-specialty group like the Palo Alto Medical Foundation. And there's a lot of things that are right about healthcare, but there's a lot of challenges in healthcare. And one of the biggest challenges I think we have in healthcare is the disparities we have in outcome. The disparities in outcome we have between probably what happens when many of us in this room go in for care, even if people who are poor, vulnerable, sometimes from different minority populations get the same care won't lead to the same outcomes. So we spend a lot of money on healthcare. We have a lot of really well-intentioned people in healthcare, but we have to look at how we can both ensure that people are getting the right care, and we also have to be sure that the right care may not mean the same thing for everyone.
Right.
So how do we use data from companies like yours? How do we use human-centered design to really understand how to engage patients from different backgrounds? And how do we make healthcare radically more affordable? Because in any day, in any one of our hospitals, most of our patients are public beneficiaries. Most of them are on the programs for the poor and the elderly. So working together, what do we do to eliminate some of the quality and outcome gaps and to improve affordability?
Great.
Because we're not a healthcare company, I think our ambitions in healthcare are slightly different. We have a humanistic side to us. We have a very well-known, I think, philanthropic side, our 1-1-1 model, and the philanthropy of our employees and our CEO and all of us. So we have the same goals that I think all of us here have: greater access, greater health, lower costs, and smoother journey. But from a technology or from a business standpoint, it's interesting. We serve so many different industries, and we see healthcare lacking in some of the technology, some of the smoothness or frictionlessness that we enjoy from so many other industries. So our ambition from a business standpoint could be maybe described as helping to bring some of the innovation that we see in so many parts of our world to healthcare with the ultimate goal of these kind of humanistic goals. And I think the way that we do it, we really respond to our customers. And it seems like in healthcare, when we say healthcare, we're talking about so many different segments and so many different locations and so much variety that rather than go into these sort of markets or opportunities with a strong perspective, we tend to listen to the folks and try and meet them where they are, because we've seen a lot of failures from top down or too ambitious goals, and it helps more to start where the organization is and to help them grow in their capacity to adopt and use some of the technologies and methods that we have.
Okay. So we are, let's say, our main purpose is to make healthcare providers, and healthcare professionals more successful. Yeah? So we believe that our best contribution to the health of individuals is to help those whose professional work is to be healthcare providers or healthcare professionals. So, a maybe simplistic way to illustrate it, I think in the 19th century or so, when for the first time really medical doctors, when this became a profession, yeah? Back then, when you had a health problem, you went to a physician and you had the feeling this one physician has the knowledge of the world. Yeah? So this is the basic moment of medicine, yeah? The interaction of a physician with a patient, and the patient trusting that this is the best you can get. Yeah? We have gone through progress after progress and subspecialty building and so on and so on. And this we have much better healthcare, but we also lost this basic moment, yeah? Because now it's about second guessing, finding a second opinion. Is this really the best professional I have? Is the diagnosis right? And so on and so on. Yeah? And helping to use technology, yeah, so that we use everything we have today and rebuild this moment is one of the inspiring thoughts, yeah, for me at least, yeah, we are after. And if I may comment, yeah, I mean, you said healthcare is lagging behind. I have changed my mind. I believe healthcare is harder, yeah, and that when it comes to applying digitalization and artificial intelligence, healthcare is harder.
Why do you think it's harder?
It's the hardest problem. Yeah? Why? I believe because it's about, I mean, trivia, it's about human life.
Yeah.
Yeah? A treatment or a therapy recommendation is much more important than a restaurant recommendation. Mm-hmm. Yeah? Yeah, it needs to be right. And it's also so it's the trust topic, and what we also need to see in healthcare, there are many people, and this is something I also learned over time. Yeah, a physician has spent 10 years of his or her life, to become a physician in this very field, and then he or she is certified to do exactly that and nothing else. Mm-hmm. Yeah. So it is also hard to change, yeah, because I mean, in Siemens Healthineers, you can reinvent yourself, you can do this, you can do that, yeah. In healthcare, this is not possible, yeah, because we certify individuals, yeah? And now it's about helping these individuals, yeah, to do a better job, yeah, and to also respect the kind of brown field we are in, yeah. So I think there are many topics, yeah, which just make it harder, yeah. And which is not about, because I often hear healthcare is traditional, is conservative, and so on. I think it's just more difficult. Yeah?
So given that healthcare is hard, why do you think, and I'll turn this to Josh, why are so many technology companies getting more and more interested in healthcare nowadays? You see from this room and from the landscape, there are more and more companies within and outside of healthcare coming in. You know, Salesforce has been working with healthcare companies for a long time, but have recently invested to do this more deeply. What are your thoughts on that?
I think there are maybe three that I'd mention. First is, obviously, it's a gigantic business. It's 1/6 of the economy, and what's always interesting to me is that companies that I never thought would be in healthcare really have a gigantic healthcare mission. Companies like GM or Shell that employ hundreds of thousands of people find themselves in the middle of a bunch of very complicated health questions. So it's a big part of the economy. I think the second reason is that we really care. Every single person, every one of us in every company everywhere, and ours included, encounters the healthcare system. And it can be a real challenge when you come from a company like Salesforce and you're in Silicon Valley, you're in technology, and the whole world is at your fingertips everywhere, and then you show up, and even people with resources and education and who understand healthcare even find it hard to navigate. And that frustration, I think, motivates a contribution. And then the third, I think, is the most salient, which is, and it connects to the second, which is the technologies that we see all the time, sort of born by so many of these great companies in this area and all over the world, are really necessary or really needed right now more than ever in healthcare. Because of the lag, it's nice, it can be challenging at times, but it also is inspiring to us because we know where it's going to go. We know the kinds of technologies that are going to be in place soon. We can believe in the frictionlessness that's coming to us. Yeah. And I think tech companies everywhere feel like they can make a contribution, and so maybe that's in part contributing to their willingness to do it.
So given your perspectives as a clinician and also at Salesforce, where do you see the areas where competition's really heating up in healthcare today?
It's interesting. I see the biggest competition in the things that are the most, that you would think would come from a traditional health provider. So if you think about 10 years ago or 15 years ago, if you wanted to get your cold looked at, or you wanted to get your knee imaged, or you wanted to get your blood checked, there were really only a couple options. You'd go to your doctor, you'd go to the hospital, and that was it. And now the whole world is open. If you talk about sort of looking at your cold or your flu symptoms, you can go to the hospital, you can go to the doctor in your clinic. You might have a clinic inside your employer. You have an urgent care you could go to. You could pick up your phone or open up your laptop and get a telemedicine consult. And it's those kinds of services that we see a lot of. So it's telemedicine versus traditional providers. It's surgery centers and imaging centers that are standalone versus traditional providers, hospital systems. And then you see, I think what everyone sees all the time are the retail companies, and Amazon, and all these other companies that feel like they can make a contribution with, Amazon's PillPack, for example, or with CVS. There's a lot of organizations that feel they can have something to offer, and in fact, they really are offering a service to people, and their success is, I think, a factor, or at least it stems from how many people really want to use them to solve their problems in a day-by-day way.
And Sarah, for a health system that's adapting to this proliferation of choice, how do you think about this?
Yeah, what's interesting for us is we have all of the traditional competitors, right? And Northern California is a very competitive market. We have competitors like Kaiser Permanente that when they started, they sort of broke the mold in terms of a model. And I used to work at Kaiser Permanente. I have a lot of respect for them. So you've got competitors like that, highly integrated, but that are now very mature systems. There are other healthcare systems. But then depending on what part of the healthcare sector you're talking about, you may have somebody who only focuses on diabetes care. You may have people who only focus on young unemployed people in San Francisco, right? You can have a startup like a One Medical that's really focused on a particular demographic segment. Telemedicine offers the opportunities of boundaryless care, but it's actually fascinating to date what the statistics have been in terms of the adoption of video visits and even certain other kinds of asynchronous visits. Some of that has to do with what are some of the challenges all of you are going to face. The ways that we accredit and license and regulate healthcare don't have anything to do with the ways that healthcare could be practiced when it is assisted by technology. So we license clinicians by state. So you think about licensing clinicians by state and you think about telehealth and you go, okay, that doesn't make a lot of sense, that's right? So non-traditional competitors and more traditional competitors, and then people who are working together, right? So they may be competitors in part of what they do, and then they may be working together in another part.
And how do you address those barriers? There's a question from the audience asking, what's the biggest factor in overcoming this instinctual risk aversion, the regulation and things like that, and bringing patients, providers, and others along?
So, I think some of it is, this is going to sound really corny, but really some of it is bringing the patient's voice in.
Okay.
So our approach to innovation is very much an approach that uses human-centered design. Our head of innovation comes out of a background from IDEO. And it is amazing the value of bringing that patient's voice into the conversation and having people really address the patient's pain points. Mm-hmm. And some of it is they're looking for the same convenience in their healthcare journey that they can have everywhere else in their life. If they can schedule everything else in their life on their phone, why can't they schedule their physician's appointment? If they can find out real time where their pizza is, why don't they know where their lab test is? All these kinds of things that they expect. And then there's that next layer, which is how do we actually have technology be additive to the clinical experience and to the patient's experience? I do think that a challenge everyone who wants to work in healthcare will find is that the regulation and the credentialing lead to this circular culture that we develop in healthcare. Risk in healthcare has a really bad name. Mm-hmm. You think of data as valuable, we can think of data as really scary, right? Oh my gosh, it's HIPAA protected, and really bad things happen if it gets out. And so having people think about experiments, right? Everybody who has grown up in healthcare is much more comfortable with the term experimentation than risk. It can mean the same thing. But really finding safe ways to do that, because as one of my fellow panelists said, it's one thing to experiment and you're experimenting in a restaurant and you make a souffle and the souffle falls. It's a little different than you've experimented on somebody in their medical care. So you want to find safe ways to experiment.
And Bernd, how have you seen it in the med tech world in terms of innovation and new competitors coming in?
Yeah, maybe some fundamental remarks, how we look at it. Things. I mean, we are a global company.
Yes.
And why I say this and why this is important, yeah? I mean, the way we look at it is, there's one quote which I really like: "Med tech is global, healthcare is local." Yeah, I mean, Sarah spoke about, there's credentialing on a state-by-state basis, yeah? There's the US healthcare system, yes. Yeah, which is totally different from India, China, the UK, or whatever, yeah? So we are basically dealing with, we have direct presence in 70 countries. We are dealing with 70 different healthcare economies, and a lot of the technical answers are local often, yeah? I mean, when you look at the EMRs, for example, Cerner and Epic, yeah, they more or less only exist in the US, yeah, because they hardwire the US healthcare rules, right, so to say. Yeah. We are global, but that also means that we have a hard time when something really is just local, a local deployment. Mm-hmm. This is for the local reimbursement and so on and so on. But that's also our advantage, yeah, so that when we have technologies which can scale, we have the infrastructure to scale it everywhere, yeah. And from that point of view, for us, competition is different. It is much harder, on the one hand, yeah, to, so to say, enter our space, yeah, because we have the scale advantage. But on the other hand, we can be a platform to deploy innovations on a worldwide basis. We currently don't see so much, that somebody comes and is a completely new entrant. Of course, I mean, we see, for example, in the field of AI, and that there are startups who have. I mean, I once heard the joke. Yeah, it takes 5 PhDs and a doctor and a dog, yeah, to run to build a company. Yeah. But in the end, then you have an algorithm, yeah? And what you need to do is to then deploy it and so on, make sure it becomes part of the workflow and so on, and that it goes through the firewall of the CIO and so on. And there we find models of coexistence, yeah?
Maybe it's only in Germany that you need PhDs and doctors to start a company, because here you don't even need to go to college, you know? You can just-
Yeah, okay. We are very regulated here.
So, but I mean, on that topic, how do you see, when you think about AI and the startups that you work with, innovation that's happening outside of the US and the applicability of bringing that here and vice versa? How is Siemens thinking about scaling that innovation across?
Well, I mean, what we do is, I mean, on the one hand, we literally, I mean, provide an ecosystem. Yeah, I mean, I mean, we have in our software platforms, you can basically plug in, yeah, and become an app, so to say, on our interpretation software and so on, or deploy AI algorithms. Yeah, we do this. And I mean, we recently, I mean, so this is something we do with a company, Arteris, yeah, so it's deployed on our network. So here we are basically a little bit like like an app store. I mean, we have on the more hardware side, I mean, we have partnerships to build stuff on top of our products. But I mean, we also do traditional things. I mean, we just recently, one month ago or so, did a larger acquisition of, I would say, startup. Yeah, but still, it was a 1 billion acquisition of an endovascular robotics company based in Boston, Corindus. Yeah, where we see it makes sense, yeah, to combine this with our technology and then have, with a better integration, a better way to treat patients.
Okay. And I'll turn it back to Sarah here. There's a question from the audience. With the proliferation of industry increasing, how do larger traditional incumbents partner with smaller, more agile innovators to solve healthcare problems?
Yeah.
So how is Sutter thinking about partnering?
Yeah, so a great question. You know, my view is we have this incredible gift, right? There's smart people all over the world, absolutely. But we sure got a lot of incredible talent here in Northern California. And so I think we're really lucky that we can find both innovative companies at scale. So we have some really large, very creative companies here in Northern California. And then we also are surrounded by a very entrepreneurial community. So honestly, our goal is that we want to cooperate with the innovation that's around us. And sometimes it's really helping that innovation see how it can apply to healthcare. So let me give you an example of where I spent this morning. So before I came here this morning, I was in our neonatal intensive care unit in Berkeley at Alta Bates Hospital. So this is where very sick babies, often premature, go. And I was visiting with some parents and the care teams there, and they're using technology, and actually we have a physician here who helped develop it, and he's in the audience today. So they're using iPad-based technology so that they can be at home and actually see what's happening in the hospital and have real-time access to the physician's notes, to certain vital signs, et cetera, so that, you know, if any of you have ever had a very sick relative, it's really hard. You feel like you should be there all the time. And you just think about that if it's your baby and that baby's been born at 23 weeks and weighs a little over 2 pounds, and you really don't know hour to hour if they're gonna make it. You may never wanna leave their side, right? So, and that is an example of a technology that is not technologically difficult, it's culturally difficult to get the nurses to say, oh my gosh, like they're gonna have questions all the time, and what's that gonna be like? To have the neonatologist say, well, what if they panic when they see that lab result, when that lab result is always gonna be there for a baby that's born at 23 weeks? They don't need to panic. Of course we know about it. They don't need to call. So we have that kind of technological adaptation that's really more something that is not technologically difficult, but is culturally difficult. And you know, then we have other kinds of experiments that we're doing right now. We have a completely virtual clinic where the physician and the care team see 100% of their patients virtually. We have some technology that we've done with a company that I don't know how many of you in the audience love to get your blood drawn, but if you were very ill, you would really hate the number of times we poke you. And so this is a technology that is essentially has a two-way valve so that you can draw the blood through the same stick that you use to give IV medications. And we have that in a pilot phase in one of our hospitals. And so many of our things are small proofs of concept that we're then spreading. Many are things that are about technology that's already available in non-healthcare settings, and how can we make that available in a healthcare setting?
How do you get to that scale part, right? Going from something small to scaling. There's a lot of people here that have been doing a lot of proof of concepts or pilots with bigger organizations. What's that tipping point for you?
Gee, I would tell you that we still struggle. And part of the way we struggle is adoption of new anything in healthcare is actually very hard. So the mantra is always, physicians are scientists, you give them the scientific evidence, they'll change their practice patterns. Not true. There's study after study that will show you that physicians practice in the way they were trained, and that the variation in what happens to you as a patient has much more often to do with where you live and where your physician lives and was trained than it does to your underlying clinical condition. That's some of the work your company is helping us with. And so some of it is the basic change management that happens when you're trying to get a physician to change their prescribing pattern for a medication, trying to get them to change whether they induce labor for a woman at 38 weeks instead of letting the woman go to 48 weeks, or new technology adoption. It's the same change management. I would tell you that the most important thing is marrying that end benefit for the patient with how is this not going to make the clinician's life more complicated? How is this either going to improve a pain point for the physician or for the nurse, or at least not be harder? And if you can do those things, better for the patient and not harder for the clinician, I think that really helps with spread. But spread is tough.
Yep.
Spread is really tough.
And how, related to that, how would you think about, and I'll turn it back to you two, where do you partner versus build something yourself versus compete? Because, you know, we talk about co-opetition and how we have a new paradigm between competing and partnering. How do your organizations think about where you want to partner versus where you think, oh, this was a good idea, we can do this ourselves, actually. We'll just build it and scale it ourselves?
This is, there's no fundamental recipe. I think where I completely agree with Sarah is this creating change in medicine is extremely hard. Yeah? I internally always distinguish between market share topics and make market topics. Yeah, as an example, when we build we are the world market leader, yeah, very proud, in MRI. Yeah? So, okay, we build the next MRI, it's a market share topic. Yeah? It's not, everybody understands the concept. Not everybody, but people, it's an established category. Yeah? It's an MRI. When it comes to establishing a robotic endovascular procedure, yeah? Which is now what we do with Corindus, yeah? Which means changing medical practice. Yeah? That people say, no, I'm not doing this by hand. Yeah? I'm doing this. This is a long journey. Yeah? And when it comes to this, make or buy decisions, yeah, it's also very much a question where in this adoption process a technology is. Yeah? And I think this is something which, everybody should be aware of, yeah, when it's not about a patient app or a consumer app, yeah, that the way of changing practice, changing the day-to-day behavior of a physician, especially of a subspecialty physician, is very hard work. Yeah? And you can have a great innovation, but the innovation in itself gives you 5 to 10% of the to the finish line, and the rest is a lot of proving, talking, creating evidence, and so on, reference sites, pilot customers, and so on, and so on.
For us, We want to be the best at CRM and integration and analytics. We also have made some acquisitions recently that are large in those areas, with MuleSoft for integration, with Tableau for analytics. And for CRM, we want to focus on marketing and sales and service and e-commerce and so all the touch points between an organization and a customer, regardless of who that customer will be. But we're not a healthcare company, so while we make acquisitions and we do internal production of systems to do those three main areas, we don't know population health. We don't understand a lot of nuances of healthcare that require clinicians and nurses and data scientists who know healthcare, health services researchers, for example. So we partner with a company called Kairos, for example. They do scheduling and they build physician indices for all the physicians that might be employed, or a company called Genea that does population health that came out of Capital Blue. And by connecting, in the Genea's case, their data and their algorithms to Salesforce's communications and CRM technologies, we enable our customers to reach out and affect registries and the kinds of lists and intelligence that comes out of those analytics. Or with Kairos, we enable our customers to use the physician scheduler or a database of all the physicians in an organization, cleaned and credible with all their information, to reach out to them and to run analytics on them and to bring them closer to the organization for referral management or to build a physician network. So I think the simple way to say it is we do the technology and we have a whole raft of partners in healthcare. And I'll also say that I think we're a lot like you all, I'll be bold to say, in the technology community, in a modern technology community, that there was a model from a while ago that was, as a technology company, you were going to be the single big incumbent, you were going to be the monopoly, and you were going to keep everyone else out. And as I think our company has grown, and you've all seen it, we've really grown with openness and transparency and a real willingness to partner, even in some cases with competitors, to solve problems of our customers. And I think that's the new way, and it bodes well for all of us, and it makes the world a lot better place. And so we're really open to it, and we find there's a gigantic ecosystem of folks that are willing and interested to help.
That's great, and it sounds like you make your decisions based on what's your core competency versus what skills others can bring, and then be open to working together. There's a few people in the audience that are asking, Salesforce's Health Cloud is uniquely positioned to be able to aggregate data from a multitude of sources. How will Salesforce leverage this capability? Is that in your core wheelhouse that you feel?
Yeah, so I'm really proud of Health Cloud. I was running the team that built it and launched it, and it was something that we're really proud of. We are different from some other companies. We don't really look at we don't look at your data. We don't look at our customers' data. That's not our business. We help our customers to use that data. So the real way to answer the question is we are always building and always innovating to help our customers use that data. And they are bringing together data from their claims, their clinical data. They're starting to bring social determinants of health data, which I'm sure many of you know about, consumer level data. And the more people can know about their patients, I think the better job they can do. And we see this in all the industries that we cover, in hospitality and retail and consumer goods. We see our customers using that data, and it gives us, I think, a lot of pride and satisfaction to see our customers using those same technologies and those same broad range of data to take care of people and to build those human connections that I think Bernd was talking about, which is something that we're excited to see come back into healthcare.
And you bring up an interesting point there, which is also attention, which is a lot of us as consumers, we know that marketing companies and other places outside of healthcare, what they know about us, and that causes differing levels of discomfort. But when it comes to patient data and how organizations use that data, there's a high level of distrust there. And one of the questions that's rising to the top here is around how do you solve the issue of trust with tech and healthcare? And what are patients willing to exchange for better care related to their data being used?
Yeah, so one is I don't actually think they should have to give up anything in order for them to get the outcome they want. So it's their data. So if they want to share it, wonderful. If they don't want to share it, that has to be wonderful too. And so I think that the idea that I own their data or Salesforce owns their data or any one of a number of organizations that build their platform on the idea that then that what they have to sell that's valuable is that they've aggregated other people's data. I don't personally think that is the right model. Now, it is a model, and there are people who are very successful using that model.
Health systems that are actually capitalizing
health
on,
systems that are
on the data that they
capitalizing
have.
on that, people who are figuring out ways to do that. And there certainly is an enormous benefit to de-identified data being able to be used in very powerful ways for both clinical research and other kinds of research, right? But the idea that I would have to agree to something that invaded my privacy in order to get clinical care is not something I think we should be building our business model around. I think we should separate out people's voluntarily willingness to give de-identified data from whether or not in order to actually receive clinical care, they have to be willing for their data to be exported. There's such an asymmetry in the knowledge of what might happen with that. And it's really quite a fascinating thing, even right with searches, right? What starts to happen, right on that border of interesting and creepy when people start to search for medical information, which is among many age groups is the single most searched subject on the internet, depending on the age band that you look at. So I think it's something we all need to be aware of. I'm a big believer that data belongs to the patient, and that if they chose to give it to us, God bless them, but if they don't choose to give it to us, we should all work together to be sure they get great care anyway.
Do you agree?
Yeah, definitely. I mean, from our perspective, I mean, it's a bit sad on the one hand, yeah. So we have on our machines, yeah, every hour 240,000 patients are examined, yeah, or the blood, or they are imaged or whatever. We don't have the data, yeah. I mean, we have maybe the machine data, usage parameters, and so on, yeah. So it would, in theory, be nice, yeah, but we behave. On the other hand,
is that better for the patient? Because what if you were able to leverage all of that to be able to actually improve care?
Yeah, but then people should know. I mean, what we do is we in clinical collaborations we collect curated data, and then this is in the end the important stuff. Yeah, I mean that we have curated medical data, which is the data plus the human interpretation of it. Yeah, we have about 700 million curated data sets of medical images, patient data, and so on, yeah, which are collected in a agreed upon way, and this is our data lake on which we train our AI algorithms. Right. Yeah, so to some extent, this becomes a bit like a machine. Yeah, so you have your data lake. Yeah, you have your supercomputer, and then you scale the development of new AI-based software. It's a machine riding the next.
That's right. And this at Clarify, we think about this all the time because we're trying to leverage the power of knowing a lot about clinical practice and other things, but balance and being able to bring that to the N of one physician-patient interaction to be able to inform that, but at the same time maintaining the levels of trust and privacy that people want and need. But I think that we're seeing in all areas of social media and other areas that we're pushing the bounds of what is and isn't acceptable, and perhaps there's generational change around that too. So for all organizations working in this space, it's a constant adaptation. So switching topics a little bit, there are a number of people who are asking about value-based care. What do you think about value-based care? How disruptive are the Oak Streets of the world? Thinking about disruption and competition versus evolving, how would you answer that?
So it's a big question. Any of you who watched the Democratic debate, it was just a question of what did they really mean when they talked about Medicare for all? Did they mean Medicare for all who want it? Medicare for a lot more people? Did they mean everybody would have to participate in Medicare? So at the same time as we have the value debate going on, people mean very different words by that. So some people, when they say, what do you think about value? That's really a pseudonym for them for prepaid healthcare, meaning that there's global budgeting, you give a delivery system or a risk-bearing organization a set amount per member per month or per beneficiary per year, and then there's an incentive to manage the care within that. Some people, that means you pay fee for service, and then you pay some additional amount depending on the outcome. To some people, it means what it meant to many on that Democratic debate platform, which is let's take money out of the non-value added services from their perspective. Although for people who've ever worked for an insurer, there's a lot of work that goes into being an insurance company. But let's take the money away from the non-value added services so that all the money is theoretically going directly into care, and we're going to eliminate all the middlemen. So if this question is really about, is there a real benefit in looking at health from a more prospective basis and looking at what are the things that could be done fundamentally differently to catch diseases earlier, to prevent the trajectory of disease, not just in terms of cost, but in terms of human suffering, right? There probably isn't a healthcare organization that I know of, a responsible one, that isn't working on what does population health or value-based care really mean to them. And there is a ton of entrepreneurial development in that space. And I would tell you that's been another place where scale has been hard. Very often you'll have a fanatical alpha site where there's a physician or a care team that's incredibly bought in. They develop a new care model. It's very technology enabled. It maybe can sped to the other partners in their practice, and it's been really hard to scale beyond that. So I think we need a lot of bright people in rooms like this really working on this question of what are those things that actually really work. And my opinion, based on the data I've looked at, it's not the way we originally approached value-based care or population health, which is that we did everything for everybody regardless of their risk. It's not about taking people like me who run every day and saying, we're going to give you an incentive to track your exercise. That's great, I'll take the incentive, but it's not going to change my habits. It's really going to have to be a much more nuanced approach that also takes into account the parts of healthcare that the healthcare system's not as good at, like mental health and addiction issues.
Thank you. So we are running out of time for the panel, so I will finish with a lightning round, asking all of you, if you were to pick one big technology or company with a technology that you think you're really excited about that could transform healthcare over the next 5 years, what would you pick?
Can only be us.
Siemens Healthineers is the answer. Yeah.
Thank you for saying that, because now I can say CRM, because I really see it, and I see it in combination with this value-based purchasing thing.
So it's the cooperation thing
it's the
you talked
cooperation.
about. Okay.
You know, with value-based care, we see the importance of taking care of people at home and programmatic communications, otherwise known as marketing, and call centers and mobile apps and the things that we do. And it's not accidental. It's because we all see it working everywhere else, and we want to bring it to healthcare. And I think that connected with AI, not only for putting genes together and understanding images without radiologists, but really to understand people and what they want and to give to them, hopefully, a semblance of the kind of connection and answer to their questions and anxieties that I think physicians used to do one-to-one, and now organizations have to do. And we've seen plenty of organizations that know how to connect to us in ways that build loyalty and love and delight. And we're excited to see healthcare organizations do the same.
Great.
So I'm going to give a very different kind of answer. So, you know, if I had to pick one technology, and I don't know whether it'll be this company or one like it, I would pick the kind of company that Ada is. So this is an organization that uses AI to deliver medical care to the hundreds of millions of people around the world who will never see a doctor. And then, we're looking at how can we use that same technology to provide some self-service to people here in Northern California. But from a global perspective, I think that's the kind of thing to really watch. What are we going to do for all of the people who really have no access or very little access to healthcare?
Great. Thank you all very much for your time today. Thank you, audience.
Great.
Thank you.